Joining me now is Wendell Potter. He's the president of Medicare for All now. He's also someone that Time magazine called the ideal whistleblower when he worked for Cigna in the healthcare industry, and Michael Moore called him the Daniel Ellsberg of corporate America. Wendell, welcome back to the Young Turks.
Thanks, Jake. How are you tonight?
Great. I want to talk about Medicare for all those who want it. I want to talk about Obamacare. I want to talk about what the health insurance industry does. But real quick, what is Medicare for All now?
Medicare for All now is a nonprofit organization that makes the case for moving to a Medicare for All type system in which we have guaranteed health care, in which we're not dependent on our employers to provide our health care for us. We know that we need to move to that system. I used to work for the health insurance industry for 20 years. I know all their tricks. I know what they try to do to perpetuate this system to protect profits. And we need to eliminate the private health insurance system in this country to move to a system like we've had in this country for 50 years for people who are 65 years old or older, people who are disabled. It's a system that works and it's much more efficient than the current system and will save this country a lot of money and give everyone guaranteed health care.
So I had somebody ask me over the weekend, well, Buttigieg says Medicare for all for those who want it. I mean, that sounds like a choice. Who would be against a choice? How do you answer that, Wendell?
Well, the choice that we really care about is choice of healthcare providers. And I use that term because when we refer to providers, we mean healthcare doctors and hospitals. What has happened over recent years is because we've had health insurance companies running our healthcare system, they've eliminated the choice that we care about. We can no longer count on our doctors being in the networks that our health insurance say that we have access to, or the hospitals either. So what we're talking about when he refers to the word choice, he and the insurance industry are trying to make us believe that we currently have choice. We don't have choice. Most of us who have private health insurance get it through our employers, and our employers are the ones who make those decisions as to what insurance companies we have access to, and they and the insurance companies decide which doctors and hospitals we can use. So I wrote a New York Times op-ed about that last month to explain why that is obscuring the reality of the current world. We don't have choice. And what Buttigieg and others are advocating is just a continuation of the system in which we have seen the insurance companies come between us and our doctors.
So Medicare for all and Medicare for all for those who want it, they're two totally different systems, right?
They are.
So tell us the differences.
Well, the difference is for those who want it, it keeps in place the current system that is so dysfunctional. The reason why we are having this debate in the first place, we saw in 2018 that the top issue among Democrats was healthcare. And the reason for that is because even though the Affordable Care Act did some very important and good things, it prohibits insurance companies from refusing to sell its coverage because of pre-existing conditions. It doesn't go far enough. It is a Band-Aid on a system that is broken and that we need to replace. The reality is, if you keep the insurance companies in place, you have a very inefficient system. We spend about $3.5 trillion in healthcare in this country. A third of that is wasted on administration because we have insurance companies calling the shots. We need to replace that. We need to move to a system in which every one of us is guaranteed that we will have the care that we need. In the current system, if you have employer-based healthcare, you are at the mercy of your employers. And that is the system that Pete Buttigieg wants to continue. We are all one layoff. If you have employer-based coverage, as most of us do, you're one layoff away from losing your insurance and losing your access to health care. So we need to move away from that system to a system that people who are 65 years and older currently have and have had for 50 years, of knowing that cannot be taken away from them.
So it makes it sound like, well, if I want Medicare, which is free, that we paid into it through the payroll tax, et cetera, but if I want Medicare, I could just get it because I have a choice of getting it. But wouldn't that just be Medicare for all? Because then if you get it for free, then the insurance companies wouldn't exist, because who would buy insurance that they could get for free?
Well, we don't want to have insurance companies in the mix, period. I know from my 20 years inside the insurance industry that Their main objective is to make money. So know that going into this. But if you have a system in which people can have the choice, if you say, choice of having a health insurance company provide access to care or having guaranteed health care through the Medicare program, it's very, very different. One thing to keep in mind is that under the current system, even if you have insurance, you are very likely going to be finding yourself having to go to GoFundMe to beg for care because of high deductibles and because of limited networks. And people are, even in this country, having to go to bankruptcy court because of being unable to pay for their medical care. When you're talking about Medicare for all or Medicare for some, it's a huge difference because with Medicare for all, you are making sure that everyone has guaranteed access to care that they need, reducing costs in a way that Medicare for some never can do.
So when I talk about how corporations want to make a profit and actually have to make a profit by law, sometimes I'm charged in the media with being conspiratorial. For example, Bloomberg has pumped in a giant amount of money into TV companies. Drug companies pump in a lot of money to TV companies, and I say that might affect their coverage. And they say, "Oh my God, you're crazy. Companies would never want to maximize profit." They say with a straight face. But in the healthcare industry, the health insurance companies also need to maximize profit. So what were some of the ways that they maximize profit?
Various ways. One is through something called prior authorization. That's a term that means that they have the ability to determine whether or not you'll get the care that your doctor says you need. It happens every day. And in fact, Cenk, is one of the main reasons I left my job in the insurance industry. I finally left after handling just one too many instances in which someone has been denied care that their policy said that would be covered. You hear a lot of talk about Cadillac plans, for example. There was a young woman in California who literally was in a Mercedes plan, but a medical director at Cigna said he didn't think that a transplant that her doctor said she needed the Cigna would pay for. And so she didn't get that transplant and she died. That happens day in and day out. And I just want to make sure that people understand what the reality is of a system that is run by health insurance companies. That's one way that they maximize profit. Another is to limit your choice of healthcare providers. Increasingly, we have fewer and fewer doctors and hospitals that are available to us because of the increase in the practice of insurance companies of moving us into limited networks. And they also make us pay more out of our own pockets through high deductibles than we used to pay. So in fact, more and more of us are underinsured. And most of us, in fact, who have coverage through the Obamacare exchanges are underinsured, at least 40%, maybe not most, but 40% of us who have coverage through the Obamacare exchanges are underinsured. That means that our deductibles are so high that we can't even use our policies. That's what we've got to get away from.
So when you're trying to maximize profit, you have to charge as much as possible, so hence the rising cost of healthcare costs, and pay out as little as possible, hence lower costs. In this case, is less healthcare. When you are denied coverage, so for example, we had a Just Democrat, wonderful progressive candidate, James Thompson from Kansas. He unfortunately now not running, and he's got cancer, and he's got a great doctor in Denver who will do surgery on it, and it's late stage cancer. But they said no, it's out of network, and so you're not allowed. In situations like that, where sometimes they literally give you a death sentence. They say, well, look, there's nothing we could do. We're going by the guidebook, and the guidebook says this, etc. I always wondered, is that someone's job to individually deny these things? And then they get judged based on how much they denied, and hence how much money they made for the company?
Jig, you're exactly right. You don't have to have a memo from executive management that says you have to deny so many transplants or so many procedures or so many treatments during a given period of time, but that you have to help that company, your company, meet profit expectations. And I know this from handling financial communications for a big insurance company for 10 years. What matters is meeting Wall Street's profit expectations. And yes, you will have people, and you do have people every day in insurance companies who will second guess what doctors say that you need. They will say, no, we don't think that's medically necessary, medically appropriate for you. And those, frankly, are death panels within insurance companies. I've said that before, it's a harsh term, but it's the reality of our healthcare system. You have people who work for insurance companies who know that as part of your job, you have to help your company make those profit expectations. And there's pressure on you to make those decisions. So people are denied the care that they need, life-saving care, every single day. You rarely hear about them. Occasionally you will hear about these stories, but more often than not, they never rise to and never get to the media's attention. It happens every single day.
So Wendell, final thing, I give you a layup on this one. I hear on mainstream media all the time, Medicare for All is going to take away your insurance. In fact, culinary workers in Las Vegas right now or Nevada are spreading that rumor against Bernie Sanders. Oh my God, you're going to lose your insurance. So what actually happens under Medicare for All?
Well, you will have guaranteed health care. Those workers in Las Vegas and anywhere else, even those who are in union plans or plans where they have union support to help them get benefits that they need to understand that they are all, again, one layoff away from being uninsured and unemployed. And they also need to know that they are also susceptible to just what I was talking about. People in insurance companies, if people they'll never meet, will be making decisions as to whether or not they will get the coverage that the doctors say that they need. They just don't realize how vulnerable they are in a system that we have now, how susceptible they are to their employers making the choices for us, and how we can lose our jobs through a layoff or a factory closing or a disability, and then have to turn to GoFundMe or bankruptcy court. It's not the way that we need to have healthcare in this country. And people in Las Vegas and elsewhere need to understand that just because your union has negotiated what you think is a good plan, you don't have a guarantee that that's going to be there for you tomorrow.
And by the way, you would have that plan replaced by insurance that is better, that even opponents like Michael Bennett, Senator Bennett, said is, to use your term, he said, the Cadillac plan, expanded coverage. So if you hear—
That is exactly what we're talking about. It's a Cadillac plan for everybody, not just those who are fortunate to have a union that negotiates for them. And here's the other thing too. If you're negotiating for a good health plan, what's that doing? What does it mean for your wages? Your employer is sending more and more money to an insurance company, and you're not getting the money in your paycheck in terms in wages and bonuses.
Exactly right. You could actually have higher wages. All right, the website is MedicareForAllNow.org. MedicareForAllNow.org. Wendell Potter, a bit of an American hero. Thank you for joining us. We really appreciate it.
Thank you, Cenk.
2 easy ways to follow the Young Turks. One is hit the subscribe button down below. Then you're a TYT subscriber. And second is ring the bell. And when you do that on YouTube, you're notified of our videos.